All right. Well, welcome everybody. My name is Hannah Wickern and I am with the Intertribal Council of Michigan. I'm going to be helping facilitate, I guess, the beginning portion of this webinar today. The webinar is called Building Confidence in COVID-19 Vaccines Among Your Patients, Tips for the Healthcare Team. So just so you know, this webinar will be recorded and available on our website afterwards. We'll be leaving some time for questions at the end of the presentation. So we hope to have everyone stay muted during the presentation just to minimize background noise. But please do type your questions in the chat box and we'll have time for those at the end. I'd like to introduce our presenter, Kira Hall. And also moderating today is Rhonda Ketzel. So I will pass it over to you, Kira.
Oh. All right, hello everyone. Thank you for attending our vaccine confidence presentation. My name is Kiara Hall, and I will be talking to you today about how to build vaccine confidence in your community, as well as how to address misinformation around vaccines. I'm a vaccine coordinator on the Tribal Support Section as part of the CDC's agency-wide COVID-19 response. The COVID-19 vaccine communications activities and outreach efforts that we undertake have vaccine confidence at their core. We define vaccine confidence as the trust that individuals and communities have in recommended vaccines themselves, providers who administer those vaccines, and the processes and policies that lead to vaccine development, licensure, manufacturing, and recommendations for use. So this foundation of trust is critical in achieving vaccine uptake amongst various populations and communities. Essentially, vaccine confidence is all about trust. To provide some context of vaccine confidence, we tend to think about vaccine confidence on a spectrum. It's helpful to understand that this is a dynamic process and is often expressed in people's behaviors. On one end, there are people who refuse vaccines and may never change their mind. On the other side of the spectrum are those people who are first to get in line for the vaccine. And then, of course, we have those people in the middle, the passive acceptance. This is generally made up of those who are still waiting to see what happens and really who we're trying to reach with our vaccine communications and outreach. Depending on your area of the country or community, this section may still be quite large, but for much of the US, we're seeing that this area has been shrinking as the vaccine has been in circulation longer. We see that some of those who are waiting to see have taken steps to get vaccinated. So for the movable middle that remains, we need to tailor and target our vaccine confidence messages to address specific barriers relevant to those groups. It's also important to recognize that confidence in vaccines can change. Emergence of new studies or data can shape messaging. This messaging, in turn, can shape social norms that develop in communities. For example, an individual may be on the refusal end of the spectrum, but if they begin to receive the message that millions of people have been vaccinated safely, they may move from refusal into passive acceptance or even demand for a vaccine. And then unfortunately, events can also move people backwards on the spectrum from acceptance to refusal. This slide shows data from the Kaiser Family Foundation depicting longitudinal trends in US vaccination intentions, showing from December 2020 to February 2022. What I want to convey in this slide is less about the actual numbers and more about the shrinking movable middle. The movable middle is represented by the light blue and medium blue portions of this figure. So those who think they'll get vaccinated soon, and those who will wait and see. As we discussed previously, we really need to focus on this population as well as those represented by the green boxes, those who are fully hesitant. We need to recognize that there are not heterogeneous groups, and we need to understand the factors that stand in the way of changing their vaccine intentions and behaviors. And this is from the National Immunization Survey results from March. And I wanted to note that the movable middle is becoming the movable silver of individuals. Therefore, it's important that addressing this population requires sustained localized interventions implemented with trusted messengers. Psychological and behavioral research around vaccine uptake is rich, and we can apply useful behavioral models and theories to shape our COVID-19 vaccine confidence and uptake efforts. The framework illustrated here, which was developed by an expert working group chaired by WHO, highlights how various individuals and environmental factors influence one another to impact vaccine behaviors. The yellow box represents those and feelings held by individuals, their confidence in the vaccine, and their sense of risk perception from the vaccine and from COVID. The green box represents the external or environmental influences coming from society or peer groups. These include norms and expectations around vaccine and perceptions of trust in vaccine providers. Taken together, these shape an individual's motivation, whether they intend to be vaccinated, and how willing they might be to recommend vaccination to someone else. Now, before that motivation results into vaccination behavior, there are a number of practical issues, what's labeled here in the blue box. Much of this comes down to how easy, practical, and appealing it is to actually go and get the vaccine. The takeaway here is that there are many factors, individual, community, societal, and policy, that impact someone's decision to get vaccinated. And simply targeting any one of these elements is not enough. We need to create enabling environments and social norms while also addressing individuals' fears and beliefs if we want to influence behavior. Some of these factors are within our control to address, and some are not. But data on how our communities, but we can design better communications, community engagement strategies if we have data on how our communities and community members think and feel. The social processes that affect them and the practical issues they will encounter on their path to vaccination. And so this is another way of depicting the barriers and enablers that one might encounter along with the journey to vaccination. The first step to increasing vaccine uptake is understanding the community's knowledge, awareness, and beliefs around the vaccine. This includes understanding perceived susceptibility and severity of COVID-19, as well as perceptions of vaccine safety and efficacy, and these will likely vary by population. The second step is understanding a community's intent to receive the vaccine. This is often dependent on their trust in the vaccination institutions, the benefits of the vaccine, and the social norms around vaccination. Once the community intends on getting the vaccine, they will need to prepare, and there are a number of barriers that might come into play here, such as scheduling issues, costs, transportation issues, and then also if the individual gets past the hurdle of scheduling the appointment, the next step is the point of service. And there are some considerations here as well as convenience, accessibility, and safety. There are also some considerations at play in the experience of care stage, such as how well the provider explains about the vaccine and what to expect or answer any of their questions. And then finally, there are some factors to consider at the after service stage, especially since COVID vaccines require multiple doses. Some of these stages will be repeated. In thinking about vaccine confidence, we have established the importance of building trust in the vaccine, the vaccinator, and the system surrounding vaccine development and rollout. Increasing vaccine uptake includes mobilizing individuals and communities to seek out the vaccine, to support others to get vaccinated, and to recommend and promote vaccine to friends and family. At this point in our work to generate demand for COVID-19 vaccines, we're finding the strategies to reach people and increase vaccine uptake need to be very focused and personalized. This process requires understanding what is happening to the communities and within populations that are hesitant. We need to understand who they trust, what their perceptions are, and the specific concerns they bring to their vaccine decisions. And most importantly, we need to figure out how to address those concerns. And next, I'll just be mentioning some keys to building acceptance of COVID-19 vaccines. So building vaccine uptake is like climbing stairs. In order to increase vaccine demand and subsequently uptake, it's important that vaccine educators and providers make vaccines accessible or easy to get, beneficial, or that the health benefits of vaccination outweigh the risk of COVID or other infections. That it's convenient by reducing financial and opportunity costs, desirable or appealing to others, normative or presented as a social default, and necessary for accessing things people want to get back to doing. So here are some examples as far as for building vaccine uptake. So as far as like convenience and strategies include like paid time off vacation, if you have any side effects, childcare offered at vaccination sites, evening and weekend vaccine clinics. And then as far as, for beneficial multimedia campaigns to educate the community about the benefits of vaccine, sharing data from recent vaccine studies, info available in the native language. And then for accessibility, mobile vans and pop-up clinics and, vaccines available at primary care offices, and pharmacies. And some more examples, necessary, required for entry into bars or entertainment events, required to travel, normal for peer-to-peer campaigns, have Facebook selfie and photo frames, testimonials, why you got the vaccine. And then also make it desirable. Everyone loves free food, music at the vaccination events, free admission, entertainment, different incentives, to go along as far as promoting the vaccine. All right, next I'll dive into vaccine confidence and, some communication resources. So the COVID-19 vaccination page provides information about the vaccine, how to get the vaccine, and then info for after vaccine care. There are a number of materials and guidance documents designed to assist partners with vaccine confidence. One guidance document that I want to discuss is the Rapid Community Assessment Guide. So the Rapid Community Assessment Guide provides modifiable tools to quickly gather information and insights to better understand community needs around vaccination. It's a step-by-step guide and tools developed for health departments to better understand and address community needs around COVID-19 vaccines, identify trusted messengers, and identify potential solutions to increase confidence and uptake. CDC has supported several RCAs, including Georgia, Alabama, Indiana, and South Dakota. And then next, just to have there's an example of the Rapid Community Assessment, which was conducted in 3 counties in Indiana. So the methods included for this assessment, they use key information interviews, listening sessions, observations, and windshield tours, which are essentially, driving around the community, observing signage, access issues, and other community cues, props and messaging for vaccines that they had around town. Some of the key vaccine findings from the assessment were that the leadership in all 3 counties were trusted by the community. There was a good vaccine supply with low wastage, and multiple channel communication strategies to improve vaccine confidence were in effect. With respect to challenges, they observed distrust among some community members of government and healthcare professionals, especially among those reporting a history of feeling dismissed or mistreated. Specifically, the Latinx and Amish communities reported feeling marginalized. There were also language and access barriers for some community members. Misinformation and disinformation were also identified as an issue, as they are in many other communities. Another assessment finding was the low COVID-19 risk perception. At the time of this assessment, this community was not hit hard by COVID, which was good, but also meant that a lot of people either didn't feel susceptible or didn't perceive the consequences, as severe. Hence, they did not see the need, to get vaccinated. Finally, there was a lack of vaccine endorsement by trusted leaders. Unfortunately, some of the healthcare providers and faith leaders were not willing to endorse the vaccine or encourage their community members to get vaccinated. And since the Rapid Community Assessment, the community has been working, to develop and implement strategies to address the challenges identified during the assessment. And another resource is the COVID-19 Vaccination Field Guide. So this is This is an effective strategies for increasing vaccine confidence and uptake. So within the guide, you have developed by a team of researchers with the guide of the country's leading behavioral scientists, identifies best emerging and promising practices for COVID-19 vaccination, composed of real-world examples used by health departments and community organizations across the country to increase vaccination in their communities. What can end users expect from the field guide? You can also, there's tools for, identifying barriers to vaccination and assessing community needs for vaccine interventions. There's stories from community organizations highlighting effective strategies for increasing COVID-19 vaccine confidence and uptake. And then there's also links to detailed resources for intervention implementation. And another resource is using, community arts. So arts and cultural engagement can generate, community demand for COVID-19 vaccines by making the vaccination an accessible, and socially supported choice. So local artists, they can communicate vaccine information in a way that often makes it more understandable, memorable, culturally relevant and actionable. So these images created by the community can also be shared on, different social media platforms, whether Facebook, Twitter, Instagram. And then another communication resource is the Insight Report. So CDC regularly creates reports about the status of COVID-19 vaccine confidence in the United States, emphasizing major themes that influence vaccine confidence and uptake. The report includes analysis of multiple quantitative and qualitative data sources, ranging from social listening and web metrics to immunization survey data and CDC info inquiries. The report seeks to identify emerging issues of misinformation, disinformation, and places where intervention efforts can positively increase vaccine confidence across the United States. And then the CDC website also provides a lot of COVID-19 vaccine print resources that can be distributed to your community to provide accurate COVID-19 vaccine information. All right, so continue on. So next I'll be discussing strategies for building vaccine confidence. So a really good strategy as far as finding those trusted messengers in community. So as healthcare workers, you are trusted messengers in your community. You can effectively deliver messages and validate the credibility of what's being shared. Think about who else, also might be trusted messengers in your community. They could be tribal leaders, teachers, counselors, school administrators. And then also keep in mind that it'll take more than one conversation to change minds, especially when rooted in the lack of trust, whether in the vaccine, the vaccinator, and the system. So it's important, to be patient and encourage the space in conversations to have these discussions and then to ask questions. And so here are some strategies for building vaccine confidence. Make the decision to get vaccinated visible, and celebrate it. Whether, you can post things online as far as, someone like, hey, this is why I got vaccinated. You give out stickers as far as, showing, I'm vaccinated. And then, also encourage tribal leaders and tribal chiefs and other trusted messengers of the community, to be part of those vaccine campaigns. Host talking circles where community members can provide input and ask questions. Share key messages with community members through, either social media, news media, storytelling, and other channels. And then also peer-to-peer counseling to encourage, the members to get vaccinated. And like I mentioned, within your community, it is important to make the decision to get vaccinated visible to others and to really celebrate it. You can use a trusted messenger and other community members to speak on the importance of getting vaccinated, why they support the vaccination, why they receive the vaccine, and why it's important to your community. This can be achieved by sharing, testimonials around vaccination on different social media platforms, like the Instagram, using the stories or real features, TikTok, Facebook, whether posts or stories. And also it's important to encourage tribal leaders, tribal chiefs, and other trusted members of your community to be vaccine champions. Talk to your leaders about vaccine confidence and why it's important. Ask leaders to lead by example, and if they can be photographed while getting their COVID-19 vaccine. Invite leaders to share their personal reasons for getting vaccinated and the importance of vaccination, using, once again, short videos, social media, blogs or web articles, hosting community meetings. And another strategy is to host talking circles or other spaces where community members can provide input and ask questions. So for example, virtual town halls, live Q&A sessions are great ways to offer public health professionals or other trusted messengers the opportunity to engage the public to disseminate vital information and address misinformation. These virtual meetings can be held through Facebook Live, Zoom, and other video platforms. And as we know, a lot of vaccine information is spread over social media. So to address misinformation online, you can work with your communication staff to take questions on workplace social media pages, share factual information about the vaccines and debunking false claims or myths that you see online. You can also share graphics and content from CDC or HHS social media toolkits and other web resources, link content to fact-checking resources, or referring to the CDC guides when addressing misinformation and building vaccine confidence. And it's also important to share key messages with community members. So develop messages that will resonate in your community based on the information you've gathered about their concerns, their interests, and also their needs. Sharing messages through the best channels will help increase vaccine confidence and uptake in your community. Some examples of key messages include, being fully vaccinated can help protect your family, community, and elders who cannot get vaccinated. Getting the COVID-19 vaccine is free. The COVID-19 vaccines are safe and effective. They keep you from getting and spreading the virus that causes COVID-19. And then also vaccination helps us return to activities such as, gatherings with friends and family. Okay, and next will be sharing some information about COVID-19 vaccines. So here's what we know. So from the data and extensive testing is that vaccines are effective against severe symptoms, hospitalizations, and deaths. It's crucial in reducing the spread and impact of this virus in our communities. So it cannot be emphasized enough the importance, of getting vaccinated. The image on the right, mentions the Delta variant, and this was created earlier in 2021, but, currently the Omicron variant is the predominant variant. And data still holds true. Vaccines also protect people infected with the Omicron variant from severe symptoms, hospitalizations, and death. And then getting vaccinated is important, to prevent infection. Anyone, even those who are young and healthy, can spread and get seriously ill from COVID-19. So everyone ages 5 and older should get vaccinated against COVID-19. Booster doses are recommended for everyone ages 12 and older. And getting all eligible children and adolescents vaccinated means that they can get back to social activities more quickly, giving parents and caregivers a peace of mind, knowing that their family is protected and strengthening our efforts to protect, more people from COVID-19. And should I get a booster? So yes, boosters prevent, severe disease, including hospitalization and death. Studies show after getting vaccinated against COVID-19, protection against the virus and the ability to prevent infections with Omicron variant may decrease over time. And with boosters, it increases the immune response in people who receive, the primary series. Like I mentioned earlier, everyone 12 years and older should get a booster dose. Benefits of COVID-19 vaccination far outweigh the known potential risks. And for vaccine-induced immunity is more predictable for individuals than disease-induced immunity, which varies from person to person. And then it's also more protective for a population than disease-induced immunity. And next, we just have some common questions, that people have as far as, COVID-19, the vaccine. So a lot of the misconception as far as, can the COVID-19 vaccine make me sick? So no, the COVID-19 vaccine, cannot make you sick with COVID-19. Authorized and recommended COVID-19 vaccines, they do not contain the live virus that causes COVID-19, which a lot of people think they do. And COVID-19 vaccines teach our immune system, how to recognize and fight it. And sometimes this process can cause symptoms such as fever. And these symptoms, are normal and signs that the body is building protection against it. But if you do have a severe allergic reaction after a previous dose, or if you've had a known diagnosed allergy, to one of the COVID-19 vaccine ingredients, it's important to talk to your healthcare provider, in regards to getting the vaccine. And another common question is, will COVID-19 vaccine alter my DNA? So the answer is no. So no, COVID-19 vaccines do not change or interact with your DNA in any way. There's two types of COVID-19 vaccines that have been authorized and recommended for use in the United States. The first being the messenger RNA, so the mRNA vaccines, which are Pfizer and Moderna. And then you have the viral vector vaccine, which is the Johnson & Johnson vaccine. Both types of vaccines, teach our cells how to make a harmless piece of protein, that will then trigger an immune response. And then another common question is it safe for me to get a COVID-19 vaccine if I would like to have a baby? Yes, COVID-19 vaccination prevents severe illness in people who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. So people who are pregnant or recently pregnant are more likely to get severely ill from COVID-19 compared to those not pregnant. And people who have COVID-19 during pregnancy are at increased risk for preterm birth, stillbirth, and other pregnancy complications. So benefits of receiving COVID-19 vaccine, definitely outweigh any known potential risks of vaccination during pregnancy. And there's currently no evidence that vaccines, including COVID-19 vaccines, cause fertility problems in either men or women. All right. And lastly, should children get vaccinated? And yes, everyone should get vaccinated. But vaccination is important to protect children against COVID-19 and reduce, spreading the virus to others. COVID-19 can make children very sick and cause children to be hospitalized. They can have both short and long-term health complications, from COVID-19. Pfizer COVID-19 vaccine is safe and effective, against COVID-19 in children ages 5 years and older. All right, so just in summary, vaccine confidence in the U.S. and in tribal nations, is improving over time. Social and behavioral factors, as well as practical access, drive COVID-19 vaccine uptake. A community can address, barriers and improve vaccination rates. Making COVID-19 vaccine accessible, beneficial, convenient, desirable, normal, and necessary are, keys to building acceptance of vaccines. CDC has plenty of resources to help access barriers, build confidence, and address misinformation. Trusted messengers are vaccine champions. They are critical to building confidence in COVID-19 vaccine. So it's important definitely to have open communication, and trusted messengers definitely make a difference. And then also addressing misinformation and sharing the correct information regarding vaccines. Well, that concludes my presentation. So I want to thank you all for your time, and we will be putting these slides in a PDF file, and sharing them. But yeah, happy to take any questions.
If you have any questions, please feel free to put them in the chat box, or go ahead and unmute yourself and we can address them right now.
Hi, this is Rhonda from CDC as well. I know that this audience is primarily medical professionals, right? And so that in this context, you are the trusted messenger. So and you are in a place to sway opinion and engage patients and to sway them to get the vaccine. I think, how to do that between the patient and the doctor is a whole nother seminar. But it is a really important, that role in the greater picture of, their experience when talking about the vaccine. I'm not seeing any questions in the chat, although welcome them.
Looks like we have one question. Has there been any studies demonstrating the vaccine in reducing the chances of diabetes after COVID-19 infection?
You know, that's a good question. And I'm noting that's Catherine Olgwin that's asking, and I will, we will find an answer to your question. Because yes, and recently booster 2 has brought varied discussions, especially information that this may wane quickly. Yes, I think that with booster 2, right, I think that that is really targeted again towards people who are elderly, over 50, or are immunocompromised. So I think with the second booster, and we can talk about vaccine confidence, vaccine booster confidence too. That wasn't in our slide deck, but getting people to get a booster is not. It's hard to get people to get a booster. I mean, we're certainly not even. So some people aren't even becoming fully vaccinated with their second mRNA vaccine, but also we're seeing lower levels of the first booster, let alone the second booster. So I do think that thinking through the messages that we're giving patients and that you're receiving about those boosters is important in reminding why it's needed. We see especially low booster uptake in younger ages, mostly because our messages are about the older ages are immunocompromised and they don't feel that same risk. So yeah, that confidence in the booster it is also has some of these, some of the same strategies can be used to improve that. Let's see, Kira. How to overcome hesitancy for the second booster. Many patients have stated that the second booster was rather miserable compared to the primary series and the booster. Any language to share with hesitant patients for second booster? Other than if you're not feeling well, that means it's working, right? I do think that we can look and see if there are messages as well, additional messages that are coming out of the confidence insight reports. That is a good question, and I can see how that would be really useful. So I will follow up on that one as well. Kira, do you have any suggestions for that one?
No, thank you, Rhonda. I was going to say the same thing. Yeah, I haven't seen anything right off the bat, but yeah, we can definitely research to see as far as, kind of what's out there for the second booster. And I do see we have another question. Do you have vaccination rates for the tribes across the U.S.? And unfortunately, we do not have rates specifically by tribes, because we don't have data is not really collected on tribal affiliation. So what we really do look at is county level data, and kind of look at where the tribal lands fall, and kind of look at how vaccination rates are going in that area. But unfortunately, we don't have it specifically by tribes.
Yeah, I think that IHS tribes that received IHS vaccinations, we can estimate some of those. How many of of the vaccines that have been delivered by IHS have been taken up. But Kira's right. There isn't a system to collect it for specific tribes. And the National Immunization Survey does include Native American and American Indian, Native Alaskans. However, the survey, it's done by cell phone, right? So So we can share that information, but it is also, we hesitate because we're not sure how well that represents tribal, reality, especially in rural areas. I'm looking at that slide, that other slide that kind of looks at the National Immunization Survey, which does have American Indian and Alaska Natives in it. I'll put that link in the chat, but also, there's caveats with that data set. In other words, it may not represent American Indian and Alaska Natives well, but I will put it in the chat. Are there other questions, Kira?
Sorry, I'm going back up to see if I missed any.
A few patients that had issues with their immune since obtaining the vaccine. Are you hearing anything on that? That is not something I've heard, but I think that's something we can look up as well. Yeah, that's a good question. I have not heard that feedback. On this slide, I hear this all too often, but where it says taking the vaccine prevents COVID-19, I'm finding that people are still getting COVID. My question is it fair not to state it that way? Well, I think, yeah, preventing vaccine versus preventing illness from preventing illness after getting, exposed to the virus. That's a fair statement. I do think that I think our CDC's main messages is how the vaccines prevents severe illness. And there's several ways and several graphs to show, the difference between vaccinated and unvaccinated risk and severity of illness. So that's a good point. We'll double check our talking points on that one on that slide. I've had terrible reaction to the second shot, but would rather feel that than to get sick with COVID again. And again, that kind of goes to the previous comment of, yeah, it's worse. Being severely ill with COVID is a lot different than having the vaccine effects. To remember, natural immunity can lead to death, whereas vaccine are allowed to have outcome. Well, and natural immunity versus vaccine immunity on a personal level, that's hard to address. But in on the population level, I think that's a good reason why we have those vaccines to go, to address it at a population level too, right? Natural immunity can lead to death, meaning if you get COVID, it can lead to death. I think that's, yeah, just making sure I understood that question. Has there always been resistance to vaccinations? If not, what has changed? Oh, that's a great question. That's a great question. Yeah. I think at some level there has been resistance to vaccines. In fact, the WHO information that we presented earlier came out before COVID, right? So I think the theories around why people don't get vaccinated, that's certainly been around a long time. I think what's different about COVID is it's a charged conversation, right? And so now many more people have an opinion about it where maybe before they didn't. And we certainly, we have children for vaccine programs and have had it for a long time. But there are always, that spectrum, that refusal end. So I think, I'm not sure it's necessarily changed. I just think more people know about it now. know about about vaccines. Wouldn't you say, Kira?
Yeah, I was gonna say, yeah, because I know, just with your childhood vaccines, people feel like that's been around for a long time. That's kind of what you do. You get those vaccines, even though I've definitely met people who are hesitant with that, but it's not as many that you see as far as possibly with COVID. But I think this being the hot topic as far as this is a pandemic and people not understanding the basis for the vaccine kind of was already it was already made. It wasn't like they started from scratch. So there's a lot of that misinformation. So I feel like, and then people just ran with it. So, and I think it's just more publicized as far as this hesitancy, especially with COVID-19 vaccines. So that's fine.
Well, yeah, I think right. I think the other thing is these are mRNA vaccines, which are not used all the time, although there is a history of using mRNA vaccines. But these are a little bit different too. So that may also be a part of, what's different. Why do they not do titers for COVID illness? Yeah. I'm not sure I'm the best person to answer that one. I don't know if this team is the best people to answer that one. Yeah. But again, I think over time, I think maybe it's a time thing. Maybe over time, as we learn more about the virus and learn more about, where, how the sickness and kind of that, the difference between the sickness and yeah, maybe over time, they probably might go there. But that's not our area of expertise, so. Just one other comment, older tribal members can have a mistrust of vaccine strategies and often take side effects as exposure to illness, a tough reality, but trust building, I think, is essential. Yes, agreed. And the side effects, yeah, if you don't get COVID, it's hard to say, well, I think I'll accept, getting sick. Voluntarily getting sick, meaning side effects of vaccines. So you make a good point. I think with we've been on this response for a long time, and I have family members who refuse to get the vaccines and have their reasons, right? And I think that trust building is key, and that comes back to that one slide that Kira showed about. It takes many conversations, and each time you maybe address a little bit more. I know health providers may not see patients over and over again, and so that motivational interviewing in building trust and getting them to talk about what, how can you switch their thinking? It's trust is so important. You are absolutely right. In a situation, a person got COVID-19 and they do not want to get vaccinated. They think they are already immune. Yeah, Kira, do you want to take this one?
Yeah, so that's a common misconception as far as that, that disease immunity and that vaccine immunity. So definitely with that, explaining that, just because you got COVID-19, because I've, had friends ask, like, if I already have it, why would I need to get the vaccine? I'm already, already immune. Just explaining, that varies person to person, and you still want that added, protection as far as, getting that vaccine immunity is, way better than relying, on that disease immunity, for yourself in that way. And then also, protecting others around you. Sorry for the background noise, if you heard the dogs, but, so I would, definitely for that one, just, explain that, just because you got COVID-19, it doesn't mean that you yourself, are completely immune, to COVID-19 just because you had it one time.
Right. I think, I completely agree. We vary so much from individual to individual, and the level of illness that you receive and the antibodies that you make, it's hard to tell from individual to individual the differences. I think with the vaccination, there's trials that have shown a level of efficacy. So, it's hard to know how, how to describe the difference between those, but that is definitely a common, we hear that often. I think that the vaccine helps a lot, because when I first got COVID, I haven't gotten my COVID shot. I was really sick, but I couldn't even stand up from bed. But when I got both doses of the shot, and I had symptoms. I do like sharing my story so people can understand that it works with symptoms. And that story is one of the best stories to overcome vaccine hesitancy. I'm so grateful that you like to share your story, because you have a lot of power in that personal story of before and after. And so I think that, talk about a trusted messenger. What is your name? Thank you, Samantha. Wow, that's the wrong person. Making sure I just say thank you to that person. Esther, thank you for sharing that, because I do think that you are part of a very moving target. So thank you. Do you think in time we would be testing more people for antibodies? Yes. I think, it's hard to see, we're only 2 years into this disease, so to speak. And so with time, I think a lot of things will change as it becomes part of our routine medical care. How that will change in the future. It's a good question. And I think that's for the, vaccine, not necessarily vaccine scientists, but that kind of goes back to before about titers. So, yeah, I think, over time, we'll probably go in that direction. This is about shingles, and I'm very sorry if anybody came down with shingles, because it's a very hard time. People are required to wait until age 50 because the vaccine has not been tested for those under 50. More young people are getting shingles. Is there a move to test the vaccine on younger people? You're over 50. Please get the vaccine, because you do not want to suffer. Well, I will echo that. My dad had a very, very terrible case, and I immediately went and got a vaccine, but I was over 50. So I do think, I do not know about where testing is for people younger than 50, but that is another question we can try to find the answer to.
Mm-hmm.
What about Kira? Did you want to have anything?
I'm sorry, go ahead.
I don't see any other questions. Did I miss any?
No, I think that is it. Sorry, my phone cut out a little bit.
These are really great questions. I know that there's oftentimes one of the age groups that has the biggest movable middle is, that 18 to 29-year-old group. And those are often that's been, from an age wise, a very difficult thing. And we've heard that both in the whole population, but also among Native Americans, Alaska Natives. I think that there's several pieces of that story. Everything from what we teach, especially our young men, about being tough, right? I think that's part of it. There's also, the science is kind of coming out more and more about why this group is hard to move. So, we are getting our head around that now, so that we'll have some better answers to that. But I think, as we try to think about, which groups are some of the hardest patients to move. As we go through those stories, we hope to have better answers. Oh, I see Hannah's back on.
I see we have one more question in the chat. If you want to address that, and then I think we'll probably wrap up.
Getting there, just a second. I
No problem.
started scrolling up to the top. Since there were longer times between the primary dose recommended, is it recommended to wait longer between the first and second booster outside of 4 months? Well, I would go with what CDC recommends, which is you can get your booster 4 months after your second booster, 4 months after your first booster. So, and I think the protection you get from the booster is highest right after you get a booster. So, I kind of think of the graph going up. You get a booster and your immunity goes up, and then it kind of wanes over time. And they get a booster, and you get the second vaccine, it goes higher, and then every time you get that booster, there's also you don't have to get the same one. So if you got Pfizer the first time, you can get Moderna the second time. So you have, a little bit differing immunity, which can also, it isn't to address your question about the 4 months. You can get your booster whenever you're ready to get your booster, though. So hopefully that answered the question. Did that answer the question, Kira?
Yeah. So you can, I know the recommendation is, I think now it's 5 months. Like between just like your primary series and your, first booster shot. They say, CDC recommends to wait at least 5 months. Now, if you go over the 5 months, it doesn't mean you need to start over with the series again and, then get your booster. You can still, if you've completed your primary series and if you've waited 7 months, you can still go ahead and get that, first booster shot.
Mm-hmm. Great questions.
Yeah, lots of great questions.
Mm-hmm.
All right, I think we'll go ahead and stop there. Thank you, everyone, for attending today and asking these great questions. We thank you both, Rhonda and Kira, for the presentation and answering all of those questions there. We are looking forward to answering some of those follow-up questions. And we have, funding opportunities if you are a healthcare provider looking to develop more vaccine hesitancy. What is the word I'm looking for? More tools to address vaccine hesitancy. We do have some trainings available through CDC and a few other organizations. So I urge you to check those out. I will put the link in the chat. Oh, actually, I don't have the link in the chat, but I will make sure to send out a follow-up email tomorrow with links to both information about this webinar and information about the Tribal Vaccine Equity Project with those trainings that I was just talking about. So again, thank you, and I hope you all have a great day.
Thank you.
Thank you.